And I'm not going to address this to any one person, so we'll see who wants to jump in. So we've discussed a lot of areas over the last couple of days of impacts of, what impacts the gains, what helps the gains be sustained. We've talked about timing, duration, quality, professional development, K-12 or K-3 school quality. Which one of these deserves the highest priority in the future? What is the next step in the short term?
Let me take it maybe in a slightly different direction and say that it strikes me that it depends on where you're talking about. So imagine a place where the Head Start system was so dysfunctional that it was almost defunded by the federal government. Imagine a place where home-based care is so dreadful that 63% of the kids enter kindergarten completely unable to learn developmentally, intellectually, emotionally. Imagine a place where there's absolutely no system that sort of ties the pieces together, where the choice between curriculum development, teacher quality, accountability just doesn't simply exist. And of course that place is Detroit, which is where I am from. And so as we've thought about how to come at exactly this question, Libby, it's a very different proposition, I suspect, than from when Kate thinks about how do you sort of help retrofit a system here that is in many ways high functioning, or at least in parts high functioning, somewhat high functioning, not functioning at all.
All the children are above normal.
Yeah, absolutely, all above average. But my only point is that it is fascinating to think that Detroit is just sort of unto itself, but it's not. I mean, when I've been to Newark, when I've been to any number of places that many of you probably have been to as well, the question is the same, and it is how do you then create a system? And it may be sort of a minimally competent system, but you've got to start with the sort of the system elements, and to sort of move in one direction or another at the exclusion of others just simply doesn't work, because the entire thing collapses. And so one of the challenges that we're trying to put together, and actually taking a page directly out of the Minneapolis and Minnesota book, is to try to figure out how do you sort of build from the inside out. How do you sort of take what you have, begin sort of layering on in a sort of a nuanced, complicated way over time, the sort of the system elements that you believe are the kinds of interventions that we've talked about for the last couple of days. And boy, talk about a long-term horizon line. I mean, I had the privilege of being at the very first conference here with Art when I was at the McKnight Foundation. And I think if you had described it, this came out in a question last night, if you had described the situation of early childhood, both in Minneapolis and the state of Minnesota, 15 years ago when Art first convened that, I think people would have thought you were hallucinating. And so my sense is that what we've essentially done is create different kinds of playbooks, to your point. That different communities have sort of come at this, assembled the component pieces differently, but at the end of the day, the component pieces sort of add up to a whole. And I think for places like Detroit and Newark and Albuquerque and other places, that's the only way to go, is you kind of grab a piece of each one of these and get to work and hope that the roles and the responsibilities of different parts of the civic community can kind of help push against them in the way that they're most comfortable.
So I'm not going to let you off the hook yet.
I figured not.
So where are you starting?
You can think about what goes on inside the box, mm-hmm. whether the box is an early childhood center or whether it's a home-based care system or a Way to Grow program. Or you can start outside the box and try to make sure that parents are ready and all of the supports are ready. The problem that I think we're confronting with is we've got no box. And so we're going to start with a box. We're gonna create what Don Fraser did 20 years ago, create a set of early learning, neighborhood-based early learning centers, where you try to bring into one place the multiple kinds of programmatic support that families and kids need in order to survive. Health screening, maternal health visiting, early childhood development, Head Start programming, parent education, the whole ball of wax. And to your point, it's not cheap, but it's one of those times when I think it's a good thing to have a philanthropy hanging around, because I think that's the kind of risk-taking that probably only a philanthropy institution can take.
So this is deep and this is important. What advice or thoughts do you all have about what Rip is suggesting?
I didn't miss microphone training, but obviously I'm a little delayed. So thank you all first for having me be here. This is an exciting day. I'm sorry I missed yesterday, but how thrilling to kind of be on the panel with some of my mentors, people I've looked up to over the years, and to have those folks in this room is amazing. And I would be a little weird to offer advice to folks who've been doing this a long time, but I will say from the United Way perspective, I started as a teacher, a kindergarten teacher, and just to your point, Libby, about bringing it back to the child, I will never forget kind of my first month of teaching. I came back after a weekend of having prepared a great lesson. I stayed up all night, had a great morning story, had a great kind of plan. And I started our lesson, and I look over, and this little girl, Anna, is crying. It's 9 o'clock. I'm like, why is she crying already? I didn't do anything. She was non-English speaking, so we couldn't communicate about what was going on. And so I had one of the other students take a buddy and get the ESOL teacher to come down so we could figure out what had happened. And it turns out that she hadn't eaten since she left school on Friday. And so my great lesson plan had no meaning to her, quite frankly, because she was hungry. And she was hungry because her mother, it was the end of the month, had lost the job. They didn't have the funds to kind of get them through the month. So I say all this to say, I think from a United Way perspective, how we see this work is really about this big tent addressing the complexities, because there's a lot of things you can do in schools, but the fact of the matter is children exist in the context of families. Families exist in the context of neighborhoods. Neighbors exist in the context of communities. And so we have to be able to embrace those complexities and not run away from how we can potentially change a particular aspect of the work. But then there's a fundamental piece of, this notion that, I can't remember, maybe it's Sharon that said the treatment can't change the home environment. We've got to think about all of those different components. So I think the approach around neighborhoods, thinking about how do we really embrace the integration of dealing with the education, health, and financial stability needs of families in a complex and integrated way is going to be really important for success.
So you think Rip's on the right track?
Yeah.
Give her a hand.
Yeah, I think there's, we can try to do the strands and silos, but it becomes very difficult when you're talking about real people who have real needs that don't exist in, today I'm going to deal with my classroom issue, tomorrow I deal with my health issue, the next day I deal with the fact that my family is homeless.
Great. So, Kate?
Maybe. Great. So I don't disagree with what's been said, but just to try and mix it up a little bit, kind of come at it maybe a little bit different perspective, and not because everything is totally functional. Is this not working still?
I think maybe a little closer to your face, too.
Oh. That one works. But I'll do in a quick nutshell sort of why we've come to the point where we would say if there's one place to really lean in, it would be around alignment, particularly across what's often a highly diffuse early childhood set of systems and a very often rigid K-3 system. And we say that as an opportunity. I really put that as an opportunity rather than just kind of a problem set. The quick short story for why McKnight came to that was we actually had been investing, along with many others in this room, in early childhood for many years in kindergarten readiness. And it's true, you have to start there. You have to start at birth and up through that if we're going to talk about sustaining gains. But if the frame of this is sustaining gains, then that transition point into kindergarten becomes increasingly important. We had what was by all measures considered an extremely successful kindergarten readiness program with the district, who was working not just with district schools, but also with center-based care, really great, phenomenal professional development. And when you looked at point in time of kindergarten readiness, it was knocking it out of the park. We probably foolishly had an assumption that those gains were going to be sustained. And you all talked about whether you call it fade out or, use different terminologies. But when we looked at longitudinally what was happening by third grade, a little bit of social emotional that was carrying through, but when it looked at third grade reading, there was absolutely no difference that was significant. And this was at about the same time that I think this community in particular was really becoming much more aware of the incredible achievement gap across race and how we were really failing a large segment and growing segment of our population. So we took a step back to really say, what meaning do we make of this, and what does the research that we could find out there, everything from Art Reynolds' research to others, tell us about what the opportunity is to start to look at ways to sustain those gains over time. It led us to bring some national folks into an advisory committee for McKnight, one of whom is Christy Cowers, who was at that point really starting to tease out what a framework for pre-K3 could look like, and Ruby Takanishi from the Foundation of Child Development that had done really wonderful research around what do we know and what do we need to learn about. And it was sort of the sense of we'd given the kids the inoculation in those early years, and now we needed to figure out what the boosters were. There was also a lot of research around third grade reading, so we pretty much picked the two elements of pre-K3 alignment. What would need to happen to work better for kids, for families, for schools, for teachers, and then how to use literacy as a lens for that. And it's a work in progress. We're a couple of years in working with a number of districts and charter schools here in the Twin Cities. But I am excited that I think Minnesota now is moving increasingly into trying to figure out this alignment frame, and how do you do everything from compensation to credentialing to combined professional development to get better vertical alignment and understanding between the pre-K and some of the great elements that actually need to be brought into the particularly K and the K transition, and vice versa. What do kids need to know at third grade, and how do you back map that and start institutionalizing that? We can share more of what those experiences are, and I think there's some research questions that we would throw back to you to tease out of that. But we actually think that alignment is really about a whole set of changing adult behaviors that can be leading indicators for child outcomes. So what I have to do is kind of pull ourselves back from constantly focusing on the child outcomes, which are probably 10 years down the road, and saying what are the systems changes we see, particularly in adult behavior, and then what are the policy implications and the kind of incentives and funding systems that can help really incent towards greater alignment.
So, Kate, before we hear from Sara, Rip is starting in a whole different place. What can he do right now in his development of these centers that would help, mitigate some of the problems that you're now addressing?
Hindsight's 2020. So I would actually say, for us, it was actually already trying to understand the importance, particularly of that pre-KK. And there are there are policies, practices, ways to think about, and it doesn't just have to be the school-based pre-K, but working with centers to think about how do you create a more seamless transition experience for the parents and the kids? How do you help K3 understand better the benefits of some of the developmental and classroom opportunities that kids experience in pre-K? And I think just trying to map that in right from the start rather than retrofitting actually could be easier, ironically, potentially, and others would have more experience maybe on that point. But I think waiting to do that till afterwards means that you're having to basically do retraining of everybody instead of trying to level set it right from the start.
So Sara's from the Foundation for Child Development, where they have been working on this for really a decade. And actually, I think they get the credit for really helping the country refocus on pre-K to third grade, because they were talking about it when we were still saying, what about pre-K? Just trying to get pre-K in place. So thank you, Sara.
No, very happy to be here. And yes, the foundation was one of many partners to help bring pre-kindergarten to third grade to the forefront. Right now, the foundation is doing a bit of a transition and is defining pre-K to third grade actually as starting at birth, prenatal to third grade. So it's now trying to also focus on the 0 to 3 population. But another primary focus of the foundation is this focus that everyone has talked about today of implementation science. And so my advice to you, Rip, if you haven't already put this in your planning for your box, is to start from the beginning to really research what's happening in the program. I'm going to steal Larry Schweinhart's language of effective and efficient, but also add looking at how our programs are affecting subgroups of children in a variety of settings, right? So if we can have that frame from the very beginning of looking at what's working in our programs, what is in fact leading to the particular outcomes that we want, and doing a continuous cycle of improvement, which also provides feedback for mid-course corrections. And so if you can put that in your design from the very beginning, I think it would help to really elucidate some lessons learned for replication or going forward. The foundation has decided, though, to have a focus within this implementation science on the workforce, the early childhood workforce. So our work going forward will be focusing on 0 to 8 teachers, and not just teachers, but home-based providers, looking at leaders, so the administrators of these programs, looking at the coaching systems and the professional development systems. So our idea of workforce is inclusive of all the populations who are actually working in a center or supporting the actual work in the classroom. Because we feel that teachers, and we've talked about it yesterday, being the mediators of quality, and really the teacher-child interactions is an important factor to focus on if we're talking about sustainability and we're talking about having long-lasting impacts. We need to make sure that the individuals who are working with those kids have the skills. And I know that Deborah Stipek actually yesterday talked about the demands we're placing on the teaching staff, and it's very true in the sense of it's an intellectually demanding job to be in a classroom, because you have to know all of these skills of child development. You also have to be able to scaffold on the fly when you're with a child who's directly in front of you. You have to be somewhat of a diplomat because you have an administrative system that you have to navigate. And you also have to engage families. So you also have to be a, quote, diplomat and counselor. And that is an incredible amount of demand that we are putting on teachers and or any adult working with young children. And so we're really focusing going forward on increasing the status of the workforce in terms of the professionalization of the field, in terms of compensation, in terms of recognition, and valuing the professionals that work with young children. We're looking at trying to improve teacher practice. So looking at the ability of our teachers to provide that developmental continuum of children across the trajectory so that there is an understanding of what high quality looks like in an infant toddler classroom, transitioning to a preschool, to a first grade, second grade. So everybody has an idea of what the competencies are to do that, what the skills are needed to provide that continuum of learning. We're also looking at it from the perspective of professional development and preparation. So what are the roles of the institutions of higher education in terms of the teacher preparation programs these individuals are coming out of? Are they really targeting the skills and the knowledge bases that are needed in the classrooms, in the homes from an applied practice perspective? Are they providing the field experiences that are needed? So we want to focus on the institutions of higher education role in teacher prep, but also then the coaching and mentoring and professional development systems that come after. Because as we know, adult learning doesn't end once you graduate, right? So, and because of the high demand aspects of the job, professionals need ongoing professional development and coaching systems. So we're also trying to understand what's effective in terms of coaching, what's effective in terms of helping teachers in their applied practice. And so that's where we have decided is the highest priority, is really focusing on the workforce.
That was beautiful. Thank you. So let's stay with teachers for a minute. And I want to hear from our panel. Yesterday we heard that actually the evidence behind whether a teacher should have a BA degree and certified in or, credential in early childhood is kind of not exactly where we want. Where do you all come down? Do you think, raise your hands actually, and then I'm going to have you raise your hand. So just be ready. How many of you think that a teacher of a 4-year-old in a center-based program or even family child care, if they're teaching preschool 4-year-olds, should have a BA degree with some sort of credentialing in early childhood? Okay, what about in the audience? Okay, so there's still some split, but it seems more in terms of VA degree. So great. Okay, well, I'm going to move us to our anyone else have a comment on that? So our second question, actually, we have mostly nonprofits, actually totally nonprofits. I think I'm government here. What is the role of the private, which would be private business and or nonprofits, foundations, and what is the role of government in terms of looking at this scale up and the pre-K to third grade and promotion of it? How can we advance it, make sure we're listening to the research and putting good practices in place?
So I think this is one of the areas where United Way's in particular take very seriously the notion that there is a role for all sectors in this work. And so United Way's, here in Twin Cities and others really have done a remarkable job of kind of seeing themselves as kind of the conveners in communities, and the communities looking to our organizations and many times in many communities as the ones who can kind of bring government, corporations, nonprofit, community agencies kind of together, because these problems are so complex, challenges, I guess, are so complex and so complicated. There is no one sector that can solve it alone, right? And so there's places like Salt Lake City, for example, that has, partnered with Goldman Sachs around kind of social impact bonds and bringing government together to think about how do we have more access for preschool through a public-private partnership with United Way playing kind of a backbone, nonprofit role. So I think there is a role that's one of those examples that not everyone can go in that direction. But I think there is certainly a role that our organization locally and nationally see in terms of bringing together the stakeholders, whether it's about resources, direct financial resources, or whether there are resources like research institutions who can contribute data systems and think about how do you collect data, what are the outcomes that are important, how do they come into the mix in terms of thinking about the work, what are the community partners. I know, for example, here in Twin Cities, there's a lot of great work thinking about what are the diverse communities and how do we connect with those diverse communities in ways that make sense, Native populations and others. So I think, having a perspective that it is a big tent and there are a lot of roles that need to be played and there are different sectors that can play those roles is really key.
Okay, what about our philanthropists here?
At the risk of telling this audience a story they already know, I'm going to look right at Scott. 10 years ago, McKnight convened a group of CEOs across the region and created something called the Itasca Project. The Itasca Project was intended to try to identify what the 3 or 4 sort of large regional issues were that the private sector leaders felt were most imperative to sort of move the region forward. I think the governor, Plenty, and others assumed that it would be regulatory relief and tax reduction, and the business community came back with transit reform and early childhood development. And as a result, they set up a task force that was led by Bob Brunix, then the president of the University of Minnesota, drew Scott in, and worked with these private sector leaders, particularly Jim Campbell from Wells Fargo and a number of others, and then pulled in the public sector leaders, both in the governor's office and at the city level, and created a sort of a frame that really led to a whole suite of legislative proposals, community-based activity, and it sort of pushed back out into each of those sectors, the sort of the roles and the responsibilities for thinking about policy development, thinking about practice, thinking about identifying funding sources. And I think that in many ways, when I've gone around the country over these last number of years and talked to communities about the sort of the different roles of sectors in sort of coming to a set of problems, I almost always come back to the sort of the Itasca model, which is, homegrown right here in the Twin Cities. It's really a remarkable body of work. And I think even though it ends up sort of ebbing and flowing in terms of its effectiveness on the ground, in terms of implementing sort of specific ideas, the idea that you can have that conversation among the different sectors sort of staffed in a way that sort of plays to each sector's competence and interest is really a powerful model. And I know we've talked a lot in Michigan about trying to duplicate that, and it's very hard to do. And I think that there's a sort of a level of enlightenment about cross-sectoral cooperation and alignment that exists in this community that I hope the community never takes for granted.
So we've heard convener, we've heard planner, visioning, pulling everybody together. What else?
So I think another important role, particularly for our business community, has been and continues to be to make the workforce case, to actually make an economic case for why right now we have kind of this weird thing where most of our dollars are going at the end of the educational spectrum, when in fact everybody keeps saying the research is telling us that investing early and sustaining those gains will actually yield much better results. So I think there's a case being made for the importance of early childhood, but how we take the implications of that, I think are still very much in flux. And I think one of the roles for, hopefully for philanthropy, is continuing to take us back to what's the best evidence that we have and the research data that we can bring to bear. And I say that knowing I loved the phrase this morning that Andrew used, that many times it's confusing, inconsistent, and hard to interpret. Knowing all of that, I do think that's a role. It's for philanthropy. It's kind of continuing to push on the research side of it. How does that research play into the implementation? Those feedback loops, being able to spur some of that, and hopefully influence then how government can rebraid and align the funding sources that are available, which is where the big money is, obviously through the human services and education systems. I think, and again, this is a Minnesota-centric probably comment, but I actually think that a key role for our nonprofit and community-based organizations has really been to bring race to the forefront of our discussions here, and really trying to understand how race, cultural differences has to play in alongside of quality and access, and then how decisions are made and how funding is channeled again to incentives that ultimately benefit the families and communities. And this is all, I think, very much at play for us now. But I think those are some of the different vantage points and truth-telling that each brings. And the question is, how do you bring those different truths together to actually be able to see a whole system and not just to kind of look from only the lens where we might be most privileged to bring forth perspectives.
Yeah, the race lens brings up the equity lens, which very similar. So, Sara, what do you have to add?
Yeah, I was going to say I have very similar comments to what you said, but I think fundamentally government, yes, is the funder, but government also is the place where you can make systems change because of the role of regulations and statutes. And so that's why everyone always wants to influence what policymakers are thinking. And businesses, too, also have control of large systems, employment systems, and so they also set policy. So from that perspective, the work of the foundation is to always try to influence the decision makers, and that means supporting the influencers, which could be actually supporting the implementation science that we're talking about, funding the research, but also pushing the boundaries in the sense of identifying areas where there is a gap in terms of the research or the question. So always being key to see what's missing, what's being neglected in the conversation, because yes, philanthropy does have a role in terms of framing and issuing the conversation, and also is an area for innovation, much like government also is in terms of testing models and supporting innovation. Foundations can do that too in terms of supporting capacity building for a particular program or supporting the research about what makes that program effective. But we also see communications as being key to our role, and the foundation is actually doing a little strategic plan to deepen the communications link we have to be more effective in terms of communicating and translating the results into policy implications so that policymakers or decision makers in business or in institutions of higher education can make decisions based on sound practice and research knowledge. And that takes a real skill to communicate those different messages or the same message to various audiences. And so we're learning We have some experience doing it in the past, but we have a lot more to learn about how to be effective communicators to really make sure that the framing and the issues that we want to be on the forefront and the research that we want to make the case is actually then informing the decision makers in terms of policy and practice.
You can add.
I just was going to add one more thing, that I think over the last 4 or 5 years, philanthropy has figured out that its risk capital is probably underutilized. And as we think about impact investing, you can see a whole suite of foundations sort of entering the fray, McKnight, Kresge, Packard, others, who are willing to sort of put their capital at risk in a way that the private sector simply can't, and certainly the public sector can't. And so whether it's pay for performance or using different platforms to access different discipline flows, housing as a platform to grab housing, to grab health money or transit money, I mean, I think what you're going to see in the next couple of years is some fairly high leverage plays by philanthropy to try to help finance this work in a very different way. Not so much, it seems to me, workforce development and curriculum development. I mean, I think those are in some ways sort of more nuanced questions, but in our case, for example, building a box differently and trying to make sure that it's a sustainable financial model is something that philanthropy is really well suited to do. And we've already done this at Kresge in a number of cases on a housing platform. We've gone and reached into different sort of funding pools to create a sort of pay for performance set of outcomes that seem to be actually holding up pretty well. I just think the early childhood space just screams for this and has for a while, but I think we now are developing the requisite sophistication to sort of bring some of that financial risk taking and leverage into this space. I think it's going to be exciting. And I think Packard in particular is just about to make a huge commitment, a multi-million dollar commitment to doing exactly this.
It's interesting because we have just at the Department of Education gotten a Pay for Success Fellow, paid for from the Arnold Foundation. And this person, Janice Dubno, some of you know her. She headed up the Utah study. From Voices for Utah's Children, will be working across the department looking at how can we use government funding streams to pay for outcomes, to perhaps pay for success, pay for feasibility studies, really looking at that. So I was happy that you made government look good, actually, by saying we could be a funder, we could control systems, and that we can actually talk about change and innovation. What are some other roles for government? We have some incredible, great leaders here at the local and state level in Minnesota and other states. So what advice do you all have for them? What's their role in building these systems?
So I think Sarah's notion about communications and the bully pulpit of government really is important. I think about, for example, Arnie Duncan just made a big splash around the notion around chronic absence, right? And thinking about how, especially for young children, the notion of being absent is not a truancy issue, right? Young kids are not coming to school because they're going out and hanging out. Typically, a first, second, and third grader who's not coming to school more than 10 days, a year, there's something else that's going on. And I think that is an issue, that United Ways in particular have really seen as a great communications issue, because it starts to reframe how we talk about the fact that you can have the greatest classroom with a teacher there and all of these things that are at their disposal, but if kids aren't in the classroom, aren't coming to school, that's a problem. And if they're not coming to school, there's something that's beyond the child's control that they're not coming to school for. And so I think this notion of communication and being able to really use that position and that stature to be able to reframe some of the issues that are really hidden from the discussion in some ways is a great role for government.
So the bully pulpit. What else?
Well, I think government also is a great convener. So I don't know if that was on your list, but government can bring together different stakeholders to get different types of diversion thinking and to inform your own work. And so I think that that's also a role for government is to be inclusive of stakeholders and different thinking in terms of their own shaping of the policy while listening to all of the other communication messages. And also, I think just not government and philanthropy and practitioners and researchers and everyone in this audience can play multiple roles. You can be a decision maker and an influencer at the same time, and you're also a member of the public. So each of us can play a different role, and just be mindful of that, because that's every opportunity to make a message or a statement or an action. We don't have discrete roles, and I think that's an important point.
So state level government, one, it's not the government. I think a major step forward in Minnesota was having an Office on Early Learning to really, again, try and bring various jurisdictions within the government who relate to these issues of 0 to 8 onto a common playing field to try and have a common plan. To the extent that that exists, that it has stakeholder engagement, that can be a really powerful tool for momentum and actually really trying to have a systems map that's shared and that we can move towards and think about what the obstacles are in the way. And I'll do another shout out of just, again, opportunity set that we have here in the state was, I think, a very forward-looking legislation around dual language learners. It wasn't something McKnight was part of in the formulation, but as we've been engaging in our work in schools and early childhood, again, particularly in the state, but it's true elsewhere, the opportunity that comes with dual language learners and what we know about cognitive development and language acquisition is something we're having legislation that actually helps us start to think about what does implementation look like, what's the research agenda around that, and I would really throw that out as a challenge to all of you, since I may not get another chance to. How do you incorporate the issues of dual language learners, which were not present really in, I think, these major longitudinal studies that are constantly referred to. This is not just a metro issue. We have a small district, Austin, Minnesota, Hormel is based there. 58 languages in that small rural district. And then you just amplify that. And so I think, again, our state has some leadership opportunity there, but how does that get integrated into the broader community conversations? What does the role of each of us play? So I think, again, it's a communication issue, but then starting to think about licensing and systems and funding and the training through their centers of excellence, but also with other community providers. It's just, how do you start, again, scaffolding the sequencing of what needs to happen to actually gets good implementation that actually ultimately results in child outcomes. So I just use those as kind of specific examples of where really, the rubber hits the road in terms of thinking again about the role of the state in a state with a lot of local control too, and what that means.
I'm so glad you're looking at dual language learners. These kids come in with a great gift. And we treat it like it's a deficit. And I'm so glad that everybody is really turning their attention to the idea that these children have a gift, they have a talent, they have something we need, and are finding ways to support that instead of treat it like a deficit. Rip, I think you wanted to say something.
I was just going to try to complete the waterfall, because I think the sort of the leadership that the Obama administration has shown at the federal level, convening White House summits on early childhood, doing the kind of work that they have done is extraordinary. And I think we in Michigan have sort of a counterpart, sort of forward-looking governor who's trying to sort of elevate the role of early childhood. But I would argue that in many ways the rubber hits the road at the local level. And sorry to do this twice in one session, but 20 years ago, Don Fraser, as a mayor in an environment where mayors paved the streets and sent the fire brigades out, articulated an agenda for kids that was unprecedented in American urban policy. And he took a set of risks and built a set of models, some of which endured, some of which didn't, that actually redefined, I would argue, the role of municipal leadership in the life of kids. Not only did he start the Way to Grow program, not only did he work with Jim Rainier at Honeywell to create Success by 6, he created out-of-school time programs through our parks, he created these early learning centers that I mentioned earlier. It was a suite of interventions that I think most municipal officials just didn't even recognize because it's not what wasn't in their wheelhouse. And I think we sometimes take for granted how that has been a tectonic shift in the way municipal leadership looks at the possibilities of actually engaging in social policy. And because again, they then can stretch into workforce development issues. They can then stretch into the sort of the surround of neighborhood supports. They can stretch into the inside the box and outside of the box kinds of interventions that we've talked about. But just because he's in the room, I think history will write that Don Fraser was probably the great mayor of America over the last 20 years for exactly this reason.
That's wonderful, wonderful tribute and a wonderful way to end that question. So I'm going to go to the third question, and then it's going to be up to y'all. Which of the following early childhood initiatives are most likely to get attention over the next 5 years? What specifically do you think will get done, and how will this impact the entire continuum? So the examples, and you could talk about any of these examples or something else. Health, teacher training and professional development, prenatal to third grade, pre-K quality, quality in the early grades, sustainability, or something else. Who wants to start? They had this one too.
We were hoping we wouldn't get to it.
I'll start. I think that in the next 5 years, there will be a lot more discussion about state pre-kindergarten programs moving to full day, and hopefully at the same time kindergarten at full day, so that you have a continuum of care. It seems to be a lot of the discussion now, and tends to be something that's being talked about now, tends to be what gets done going forward. So I would say that that's probably going to be a part of the big action in the next 5 years. What I would like to see, however, is actually, I mean, I want both, don't get me wrong, but I would also like to see some action on the workforce. We've had Eager to Learn, and now we have the new IOM, NRC, NAS study on transforming the workforce. And so I would like to see there be an agreement on the competency, skills, and knowledge bases that teachers need. And I think it needs to come from the field to own that and build that coalition in order for it to be effective. And I would like to see some movement on workforce, state policies, federal policies that are supportive of the workforce and what helps and hinders the work that they do in the classroom in terms of planning time, in terms of compensation, in terms of lots of different issues around the workforce. And I would like to see there be some real attention to the professional development systems that are needed. Because just because somebody has a BA and, you know, their first year of entering a classroom, they're going to need more support than just a BA. And the field itself, we have this idea of what we need for what happens in a classroom or in a home, but where the field is so for many individuals is far apart. And so we need to also provide all of the ladders, all of the steps towards helping people reach that goal and have an acknowledgement and respect for the current workforce in the move towards this new workforce that we're looking to have, which we know is what leads to high quality and the outcomes that we want.
The teacher is there interacting with those children, and that's where the difference occurs. And then yesterday, Deb reminded us, and again Sara today, about how important those people are and that we've got to provide them the supports if they can do their job, because they can't do that job, and we have everything is relying upon that teacher-child interaction. So that's a great reminder. Marci?
I'm going to say something that's not on the list, although I have one that is on the list. But I think that kind of the conversation we were having earlier around diverse communities, diversity and inclusion, dual language learners, that is a really key factor that needs to be unpacked. The work that we do kind of spans across the education spectrum, and there's been a lot of hype and excitement about, for example, the high school graduation rates that are at an all-time high. But when you unpack the data, right, you recognize that it's working for some kids, but there are a lot of kids, particularly boys of color, who are not making it. And so I think as we start to think about from an early childhood perspective what the gains we make, and we start to unpack that data around what does it look like in diverse communities and what are the kinds of professional development that needs to happen, what does the curriculum look like, what does the family engagement look like for all different kinds of communities, given how our country looks now differently than it was 20, 30 years ago when many many of the great studies kind of got started. I think we really are going to have some intensive conversations and some new ways of thinking about how we really support and understand all different kinds of families, and really, to your point, Libby, see those as assets in our communities and not trying to fix and change, but instead embrace those the differences that exist that are not going away anytime soon. In fact, are going to probably change even more as over time. And so I think that's what I would like to see, is really get serious about how do we embrace diversity, not accept diversity, but embrace it and include that as an essential component of our early childhood system.
I love that. Embrace diversity. Kate, Rip, Sara?
I'm not good at predicting what will happen. I'd like to pick up on the workforce and just include principals in that. We're seeing principals as such a linchpin in terms of their understanding of early childhood development, their understanding of instructional practice in the school. I actually see that as just such a critical, and then just the whole leadership issue, which has come up many times. So quality, stability, continuity would be amazing things at that level, I think, to really help propel the workforce issue forward. Can I go off script, because we may not?
You can go off script.
So let me just throw out another challenge that I think we have found so much in our work, and it is the lack of stability at all levels of whether it's superintendents in districts, principals. When I think about workforce, I mean, in the schools in which we're engaged, we're seeing 50% turnover of teachers, because again, these are schools that are not the ones where teachers might want to go as they move up the ranks. And then the kids, where the instability is just incredible, which gets again to the broader context. But that's not an answer to this question, but I just throw that out again as something of just, I think, is just a set of factors in implementation that just is something that we're finding really a nut to try and figure out. And I think it gets back to the workforce issue of, you know, how do we reward, how do we retain, what kind of, you know, a status that we provide. So
Rip?
I think those answers are clearly correct, but let me just put a place marker down for the emerging importance of health policy. I think with the ACA, the world will change as we know it. There are a whole suite of incentives in that very complex piece of legislation that I think will bear directly and indirectly on early childhood development, and not just early childhood health. The impulse to sort of move upstream and try to figure out the social determinants of poor health outcomes and disparate health outcomes so that one's future doesn't really depend on one's zip code quite to the same extent, I think pushes in on so many of our systems that have for a long time sort of assumed that they were self-contained. And again, I go back to when we in Minneapolis created the Way to Grow program and had to convince folks that, you know, sending out nurse home visitors to pregnant moms or moms who have just given birth then needed to get connected up into housing services, into transit services, into social support services. Just had a conversation with Secretary Castro of HUD, who is trying to figure out how you use housing as a platform to sort of reach both health education, early education, parenting education. My sense is that just there's going to be a porousness to these systems and a sort of an interconnection to these systems that we really have to pay attention to, and that's where the big money is. I mean, the ACA is freeing up billions and billions of dollars to be spent in creative ways, and I think we all ought to just have on our radar some way to make sure that set of innovations doesn't sort of fly by the early childhood work.
So you can see we have an awesome panel. What great advice you all have. So we have about 15, 20 minutes left for you to ask the questions that are on your mind. And I'll start with my friend Helen Blank. And maybe, Helen, if you want to direct it to one or two people, just so we won't.
Well, I have a question for.
And it can be a comment too.
Yeah, you know I have a comment. And so, and I have a question for Rip especially. I mean, I think this was a great panel, and I commend, you know, all of your leadership. I'm from Detroit, and so you'll see, and, you know, I've followed early childhood policy for years, so you'll see where my comment is going to come from. First, but just in general, and I noticed that you sort of didn't address this. I think the role of government is to pay for services. And if you look at Medicare and you look at public education, and you look at Social Security, and you look at pre-K, you look at Oklahoma, you look at Boston, I mean, you look at everywhere, it's government that is paying for the supports. And I don't really believe the private sector can replace that. It can do the kind of encouragement and support the kind of research and everything that you've been doing. And I think we can't forget that. And, you know, I think you're right, Rip, about local leaders. Mayor de Blasio showed us the way in terms of a full day of pre-K. So I think it's important not to forget that, especially in terms of what's going on in Washington as we speak. So in Michigan, I think this is an incredible opportunity. I mean, this goes back a long way. I remember the day when Mark Sullivan, who ran the statewide R&R, told me that Governor Engler, this was after welfare passed, was reducing payments to child care providers to $1.50 an hour. And by the hour, most states don't pay by the hour. So in Michigan, 70% of the care had been with relatives. And this is another issue because I think when Marci talked about diversity, you need to look at the 1 in 5 mothers who are low wage, who work erratic hours and non-traditional schedules, who need more informal childcare you can't leave out. But in Michigan, it was most of it. And so over the years, they've like raised rates to maybe $2.49 or $2.59 still an hour. So I'm excited about your strategy in Detroit as a former Detroiter, because I don't know what's left in terms of a formal child care system, because centers couldn't survive in the poorest areas. So you are actually doing what you have to do. You're coming in and you're creating an infrastructure. So my question is, could you partner with the governor and make him do something about those rates? Because if you look at the number of kids who are getting child care, not nationally in Michigan, it actually makes me weep. It's like this. And you're going to need that money, because I think it's fabulous what the governor did on pre-K. I mean, just really, incredible, $135 million. But, we talk about birth to 5. We talk about wanting a community-based pre-K system. So, could he be seen as a partner in your efforts by addressing these childcare gaps at the state level?
Okay,
Be convinced that affects child development
And
families' ability to work.
Sorry to make this quite so Michigan specific, but I do think there is sort of a broader impulse here, which is correct, which is to actually invite the governor into the creation of that system. And our governor is a Republican in a Republican legislature, conservative legislature, but he is remarkably enlightened on these questions. And so I think that it would be philanthropic malpractice for us not to get his Office of Early Learning into the mix, sit at the consortium table, try to figure out ways in which their resources can be made available. And in the process, absolutely, we'll get them to raise the rates, won't we, Wendy? We're good.
Thank you. That was a good answer.
I'm so excited.
Okay, next question. Okay, I'm going to let you all control them.
I have a multiple choice question for all of you. And this is, I think, a realistic dilemma that we face. We all care a lot about evidence-based practice, right? So we have a situation where the evidence on the sustained effects of preschool is based pretty much uniquely on very high-cost programs. There is not, as far as I know, good evidence that programs that are inexpensive have sustained effects. So a legislator comes to you and says, in this state, the great state of X, I'm going to make preschool available to at least 40% of the four-year-olds in the state. But I'm going to spend half as much per child as all of the evidence suggests is necessary to really get sustained effects. Do you say yes or no?
I'm going to let Marci start. She used to be an advocate.
I'm being facetious, but I think this is basically the dilemma that we face.
I think Helen, said you can pay for something, right? But you will pay one way or the other, right? So, I mean, I think it would be hard pressed for me to say you can pay for stuff that's not good, because it's just, it may be expeditious initially, but we are going to pay, right? The notion around what the outcome, how much we spend on the other end of kids not getting that, we will pay. And so I have the advocate in me. I will fight to the death for every kid to have as good of a program as I send my kid to. And I just don't think we can say that some kids don't deserve what we wouldn't send our own kids to.
But the organizer in me tells me that, of course, you take the money. You take the money. You get you get your wedge in the door, and then you go around about the business of creating the resource space around that basic move. And I know that's simplistic, but again, we've seen that play out when I was in the mayor's office here a number of times. You'd go to someone, they'd say, well, we can pay for 20% of it, and it's not adequate, and so you then sort of leverage and try to get other people into the game. I think if your broader point is, do we become complicit in sort of a compromised system? Of course not. I think that you can ultimately figure out ways to leverage up. Easier said than done, but I think you just have to. And it may be that even though government ultimately pays for services, if they're only going to pay for certain levels of service, then you really do have to figure out how to supplement those revenue flows. And I do think that federal government revenue flows are becoming much more flexible and much more complex, and reimbursement is moving all over the map. And I think the more creative we can be about stitching together flows of revenue that have traditionally been siloed out and are now increasingly sort of cross-referential, I think the higher the likelihood is that we can actually, even if it's only from 20% to 60%, you can at least raise the bar.
Sarah Kate? We can go to the next question.
I'll just say, because I saw all the Minnesota people, because it's a live issue. So I'm actually going to make it even more of a microcosm. We had this debate recently with one of the schools that we're working with, where we actually said all the evidence is pointing to a full day pre-K is going to provide better results. And they were like, from an equity standpoint, we'd much rather, from an access standpoint, have all the kids have half the dosage, even if we know it's not as valuable. We actually, because we were trying to look for an evidence base, and there is a very real life dilemma. And again, I think sometimes I love Rip's point about trying to figure out where you're getting to the end goal and making sure that you're not making a point in time decision that is actually predictive of kind of your intentionality, but thinking about, does this actually move us towards an evidence base? How do we use this situation to actually help make the case? Provide additional evidence that actually helps make a stronger case on the advocacy basis for what we actually ultimately think should be universal kindergarten, pre-K, multiple delivery system, but really moving towards universal, because again, that is, we know that the kids who need it most, but actually given our trend lines, 20, 30 years down the road, all our kids are going to need this, we suspect.
And can I just
So-
say, I would not take the money. Let me just get on the record. But I do think it's an opportunity, right, to think about where do we push the bounds. I mean, I come at Washington right now where nobody's compromising on anything. So certainly we have to think about compromising, and we have to think about what's the end game and what is the kind of in the middle that gets you. We did this in our pre-K campaign all the time, right? Thinking about we don't necessarily get everything at once. I do think it's an opportunity to keep hammering against what is this telling when we potentially, have the compromise, we have a program that we know is not everything it's supposed to be, and then the question comes back, well, the evidence is saying this doesn't work. No, the evidence is saying it does work if we do this, right? And so I think it's an opportunity to keep pushing that envelope and not getting complacent to say, well, when the evidence comes back potentially and says, well, it doesn't work for these reasons, not because it's not a good thing.
Deb, you asked a good question. Everybody wanted to answer.
So I don't want to repeat what everyone said because I agree with it, but I would also add one factor in terms of making the case. I don't think we do a good enough job pushing back in terms of, well, you say you only have this amount of money, but what are the funds that you're looking at in terms of integrated and coordination of funds? Because there are lots of funds that exist now for early care and education. The Child Care Development Block Grant is one of them. You have, so push back a little bit and say, let's look at the existing funding streams and see how we can better coordinate your Title I, your CCDBG, your Community Development Block Grant, your anything that can be related. Maybe some of those 45 early care and education programs where they say there's an option, but it's never actually utilized as an option, can be done to provide funding so it can be done right from the beginning. But who knows if that would be successful, but it's something that I would also put into the mix in terms of the conversation, because financing and blended financing, I think, is important.
Okay, we have one more question back there.
Good morning, panel, all friends of mine. Nice to see you all. Yeah, I think one of the biggest issues here in Minnesota and probably across the country is that virtually most of our young kids are sitting on a wait list to get into a great program. And I'm looking for a little more sense of urgency out of my friends on the panel about how we light a fire in our communities and across the state, across the country, to close the access gap. And I'm a little worried that we're, focusing on really important issues about pipelines and a host of other things. I think we got plenty of research, we got plenty of kids, and I think we need a bigger sense of urgency. I just welcome a couple comments about that.
So just picking up on what I just said about coordinating funding streams, that is one way that maybe we can increase access, right? Because I don't think we've done a good job. The individual CBO on the ground is doing this, but we haven't figured out how to replicate that at a state or a federal level of how to bring all these different funding streams for different purposes for a specific goal. So you're absolutely right. I mean, there's definitely urgency, and maybe one of the ways we can do it is to communicate better how we can access the existing funds, because I think while I believe that new money is needed, and I'm not saying we shouldn't also advocate for that, I think we should also be trying to figure out how we can maybe be better in a streamlined, efficient way, which is towards effective goals, by looking at some of our existing funding streams as well.
I'll just comment, change is difficult. And we think that you can offer a small stipend or, a couple $1,000s per child for a center to improve, but that's not enough. They have to have help because they don't necessarily know how to do this. And so you just can't, you got to offer a big carrot, but you've also got to offer the supports to move from one level of quality to another level. Anyone else?
I would just say that in Detroit, that's a developed world problem that you've just articulated. We would kill for a wait list, and I don't mean that quite so facetiously. There in towns all across America, the absence of quality care is just mind-numbing. I think you actually wouldn't believe it if you came to visit Detroit. What is it, Wendy? I think 64% of all kids under the age of 5 in Detroit live in poverty. I mean, and so to get them into some structured system that works at least a little is huge. And so it's hard to know in Minnesota how you create a sense of urgency. I actually think from afar, having once been a Minnesotan and watching from afar, I think you guys have done a really good job. I mean, you've really raised the bar, raised the stakes, brought your political folks along. I mean, I get it's only partial progress, but it's really impressive. But boy, there is no more burning platform in Detroit than early childhood education. And I got to tell you that we wake up every morning realizing that we can build transit systems, we can revitalize the community, we can reintroduce markets into downtown Detroit. But unless you've got a functioning PK and K-12 system that is seamless and along the lines Kate suggested, we're sunk. And so this is the defining issue of our town.
Okay, we have time for one more question. Who's going to take it? Oh, okay, Greg.
Thank you. The conversation has been wonderfully broad, but let me broaden it a little bit. And that is, Rip mentioned the poverty problem in Detroit. And I think we're battling against a huge headwind that's been kicked up by increasing income inequality over the last 40 years. And we tend to think of income inequality in terms of the top taking off and the bottom kind of stagnating. But there's been a lot of inequality among low-income families, right? What welfare reform did was create a bifurcation where working families with the earned income tax credit and so forth are actually better off now than they were 20 years ago. But at the same time, we've got families that aren't connected into full-time work on a regular basis, where the supports have declined substantially in real terms. Kathy Eden has a book now about families that are down to the $2 a day international standard of poverty. And those numbers have grown. And it's even worse if you look at families with young kids, right? Because they tend to be young parents, their careers aren't as well established. So it seems to me that in order to make some headway, we've talked about parents a little bit at the conference, but it's involving parents with the systems that we're talking about. But it seems to me we need to have this parallel agenda for thinking about ways of supporting the economic support for low-income families, and especially low-income families with young kids. I mean, we've got programs like the child care tax credit, but we aren't thinking about gearing benefits so that they might be larger for families with young kids as opposed to older kids. Earned income tax credit, you think about that. So, you know, the kind of debates that go on in state and national legislatures for cutting benefits, people never bring the evidence about poverty and young kids and the importance of economic well-being in order to have those kids come into the pre-K systems or the K-12 systems on better grounds than they have been in the past. So don't we need this kind of parallel interest and concern so that when things get discussed either on the early childhood level or on the economic support level, we've got answers and advocacy trying to ensure that families with young kids not only have the early child care systems, but also have the fundamental economic supports.
Yeah, just to say, I really appreciate, I'm really glad that that's actually the last question in terms of kind of reminding us again of, you know, what may seem at the periphery is not peripheral, that these adjacencies and the opportunities to think of other types of system change efforts that can really provide kind of tailwind and kind of get at some of the even more uber issues perhaps that are providing constraints. And I think it's particularly interesting to think about that in terms of some of the two-generational approaches. You know, here we have in St. Paul and Minneapolis, we have promise neighborhood type approaches where I think some of that is being taken into account, but I think that's a really good thing for folks, particularly in philanthropy, to think about where we may be working in some of these different spheres. How do we help connect the dots and keep that analysis together, particularly around where there's systems issues and helping frame that in our communications as well. So less of an answer than just an affirmation. I'm really glad you brought that into the mix as well.
I think you're absolutely right. I would only say that it seems to me that actually is the good news. Is I think that's exactly what most national private philanthropy does. I mean, I think we are really focused on the plight of low-income families in American cities, and it's certainly our vision at Kresge, and I think it's shared by so many. And I also think that we actually have a rather powerful national infrastructure to advocate for those policies. I think of Bob Greenstein at the Center for Budget and Policy Priorities. There is sort of no more tireless advocate for these kinds of issues, or Children's Defense Fund. I mean, you're just running smack into classic sort of political complexity and nuance and pathology, right? And so I think you have we just have no option but just to kind of keep pushing. And I think you're absolutely right. They're not even parallel systems. There are systems that are interwoven that move forward together. And I think just as we're focused deeply on early childhood in Detroit, we're also trying to figure out issues of transit and job access and neighborhood stability and violence, all the things that, we've talked about over the last couple of days. I just think these are not separate issues. They're completely interbraided in profoundly important ways.
So, Greg, thank you for that one. So we're out of time, but I want to give my panelists, a minute each if you want to just sum up or have one last word with the audience.
I just gave mine, so I'll.
Hey, Sara?
There was something I forgot to say in terms of this implementation science and something that government, we really focus on randomized controlled trials. And I think sometimes we diminish the value of quasi-experimental studies as well. And so I think just in our work, we should be mindful that quasi-experimental studies also have important stories to tell about what can sustain gains.
Marci? Your last word?
Yeah, just, this transformational community change is really hard. And I think this last question about the complexity and the opportunity to think about the integration of it is going to be central to thinking about how do you really change the conditions in which communities live to really get to some of these outcomes over time. And so that is the central work of what United Way does in almost 1,200, communities across the country. And I think it's hard and it will take time, but a lot of people thinking about it together, I think we can do it.
Great. Well, thank you all for your good questions and thank the panel.